Okay, and I'd like to introduce Dr. Damien Chase Begay, who will introduce our seminar speaker for today. Damien, the floor is yours.
Great, thank you very much. I actually came down with a chest cold, so I'm not turning on my video, and I'm going to be wrapped up in a blanket for most of this presentation. But I am very excited to have Kim Dudik, who is the Director of Health Administration for Missoula Public Health. I'm sure she'll give us some background on the CHA, the Community Health Assessment. But this has been a while coming because of COVID. So the CHA normally we would have had out by now, but we are extremely excited to have our 2023 Missoula County Community Health Assessment wrapping up. It is on the Missoula County Voice website for public to view and provide input. And today is Kim's opportunity to really give us a first look at the results. So I'm going to turn it over to Kim, and we're going to find out about the results of our Missoula County CHA. Thank you.
Great. Thank you, Damien. And thank you all for joining us today. We are going to be talking about, as Damien said, the 2023 Missoula County Community Health Assessment. This is an assessment that we perform every approximately 5 years in Missoula County. Because we are an accredited health department, we have to conduct this community health assessment every 5 years, and then also work on a community health improvement plan based on the results of this assessment and in cooperation with other community groups. So that's just some background to what the community assessment is and why we're here. It's for all of Missoula County. This is the first time that we have included all of Missoula County and not just the city limits. So we have a map here that you can see of everywhere it goes to. And with that, we will go ahead and get started. There we go. The CHA, well, we call it the CHA, and then the Community Health Improvement Plan is called the CHIP. So now you know the lingo, the CHA and the CHIP. So this CHA is important because it really takes a high-level view of many health factors. And we're not talking about just physical health factors. We also look at things like access to childcare, or what the living wage is, or what poverty looks like in our community, because we think all of that is important to affect our health. And there are many determinants of health that impact the health of our community. The quote you see here is from the Urban Indian Health Center. It's that the health of an individual or population is largely determined by where we live, work, play, and learn. And that's why we take such a comprehensive view of the community health assessment. It really helps bring together unlikely partners to work on issues and really brings together our community to decide what we want to look like in the future. We have various health indicators that we look at, and we'll go through these in later detail. But we look at all of these. They were identified as important health indicators during previous community health assessments in Missoula County, but also based off of what the US DPHHS and the CDC looks at for health indicators to show what the health is of a community. So we didn't just choose these out of thin air. There is some precedent behind it. And one thing that we did different in this health assessment is that we included some of the health indicators that Healthy People 2030 includes. Now, Healthy People 2030, if you haven't heard of it, is the 5th iteration of a program called Healthy People. And these identify metrics that US DPHHS has gained knowledge about, how they impact the community. And that's how we figure out targets for different rates or occurrences that we should be aiming at in communities. So we actually included those with each of the indicators in this assessment, which is a newer thing, but hopefully will provide a pathway forward for the many community groups we hope look at this. One of the main things we'll look at are social determinants of health. Now, many of you probably know what that is, but many may not. The social determinants of health are non-medical factors that influence health outcomes. They're really the broad community and factors that influence our health status, such as whether or not we have access to a park, whether or not we have clean drinking water, whether or not we come from a historically disadvantaged population who's not had all the education or health resources and opportunities that others have. So these are some of the social determinants of health that we look at. And we'll reference those, and you'll see those throughout the presentation today. And to talk a little about the methodology we used for the community health assessment, there are essentially two main parts. The first is looking at all of the secondary data that we have. Now, the secondary data is data we pull from existing sources. So we look at national statistics, we look at the youth behavioral risk assessment, we look at the cancer rates. So we're not actually going out and surveying people for these, it's all secondary data. We bring that together and we analyze it for a community, and we look at how it's changed over the years. So that's really neat because we have a lot of graphs in this CHA that really show how things have changed. And then the second part is what is called analysis and collection of primary data. And this is data that we gathered from our community members. We drafted our own survey. We then distributed it to people within Missoula County and those living inside and outside of the city limits. It was done somewhat differently for whether or not someone lived within the city limits or outside of them. If they were within the city limits, we used a random stratified approach to invite people to participate in the survey by giving them a postcard with a login information that was specific to them. And then if they lived outside of the city limits, what we did this time was we had many community forums that our outreach coordinator attended, and he talked about this and he invited those people to participate in the survey. We also had it on Missoula Voice, and we had it on our social media, and in other places we are trying to reach people to get them outside of the city limits to still participate. But this did skew our results in that we had most of our people who responded, they were within the city, but we still gathered data sufficient for outside of the county. So this was actually a very well-rounded and well thought out survey. Now to do some demographics for Missoula. This shows our population where we're at. As you see, the largest group is those aged 20 to 24. And many of you probably think this is because we have the university here, and you'd be right. We have many people in that age group who are attending or recently graduated from the University of Montana, the flagship university it is, and they stay here. But you do see some drop off as people age. Our population has grown since 2017 when we last did the CHA. It increased from, in 2010, we had 109,299 residents. And it increased to 2021, about 10,000 more people. So we have 119,533 residents. 62% of these live within the city limits. And then 38% live outside of the city limits in the more rural communities like Bonner or Frenchtown or Lolo, Sealy Lake. So that's what our demographics look like by our population. And you can see male and female, it tracks almost identically, but there are more 5 to 9-year-olds who are female, and we do female by sex. So it is by their sex, current sex. And then you see that women are actually living longer. There's more older women, 85 and older. And then we also do demographics, including our race, ethnicity, and language. And as you can see, Missoula County is predominantly white. This is self-identifying, how people self-identified. And then our other, what would be considered a minority population, would be 3.8% of the population identifies as Hispanic, 3% identify as American Indian or Alaskan Native. And then we have, excuse me, that was, yeah, that's right, 3%. And then we have other 2 or more races and some other races mixed in there, but you can see that what the predominant ethnicities are in Missoula. And English is the primary language spoken at home in 95% of the homes, but we do have other languages that are spoken, which is important for us in public health, as well as other healthcare settings, to have translators available, including for sign language, so we can communicate with the public, because we do treat everyone and take care of everyone. And this just shows some of our demographics, the aging of our population compared to other counties. In the previous health assessment, the aging population was identified as a target area, because if you have ever tried to access services for those who are aging in our community, there's not a lot of them. And we're not really unique in that, but we do have a large aging population. It is not as great as Yellowstone or Gallatin recently is a higher aging population than Missoula, but Missoula is steadily increasing, and looks like by 2040, we're projected to have 25% of our population 60 years or older, and by 2050, it's expected to grow to more than 40,000 people. So ensuring the needs of those who are aging in our population should be more of a priority than I think we see in a lot of ways, but there's a lot of opportunity there. And one of the other things that we look at for demographics are, what does our disability community look like here? And as you can see, about 11.8% of Missoula County adults report having a disability. The most common one is reported to be cognitive, meaning that someone has serious difficulty concentrating, remembering, or making decisions. And this is about 5.5% of the population in Missoula reports having that kind of a disability. The rate increases with age also. We see that 30.5% of adults 65 years or older experience a disability. And then when you go younger, there's a less of a rate. With 18 to 64, it's only 9.7%. And 3.6% of those under age 18 live with a disability. So that is something we see with the age difference. We wanted to include this because we wanted to make sure everyone knew what our main causes of death were in Missoula County. And so we've identified the leading causes of death, and you can track it by year. The top 3 causes have remained relatively unchanged until COVID. So beginning in COVID in 2020, when COVID-19 hit our communities, it became the 3rd leading cause of death, replacing diabetes. And diabetes had been the 3rd leading cause of death before then. The 2nd leading cause of death is cancer. Even though the rate of cancer deaths declined, it was still the 2nd leading cause of death. And we saw the 1st leading cause of death remains heart disease. And that's been pretty consistent. We've had heart disease, except for in 2017, as the leading cause of death. And this has also been increasing from 258.4 deaths per 100,000 in 2017 to 215 per 100,000 people in 2021. So that's a rate we're seeing increase, and that has significantly outweighed most of the others except for cancer. You do see that COVID, though. It'll be interesting to see how that trends, if we still see that as the 3rd leading cause of death, or if that decreases over time. So we'll see that in the next draw, which will be in about 2026. So deaths by suicide. This is something that Montana and Missoula are unfortunately leaders in. Death by suicides, the rate in Montana is higher than the average rate, and it has been increasing. Missoula's rate of death by suicide trended downward from 2017 to 2021 to approximately 16 deaths per 100,000 people in 2019, but it rose again to 20 deaths by suicide per 100,000 people in 2021. Montana's rates have risen from 2017, and Missoula's rates was lower than Montana, but higher than the US rate. So even though we're doing a little bit better than the rest of Montana in Missoula County, obviously there is still a ways to go with that. And then we have a trend of sex also with suicide, death by suicide rates. You'll see that there's a clear difference, with males being nearly 4 times more likely to die by suicide than females. And the gap narrowed in 2019, but then it has been increasing, and it's even higher now than it was before in 2017. So that's something it's important to know these issues, because if you want to intervene, there are different types of interventions that you could take depending on age and also on sex. Speaking of age, this is our suicide trends by age. You'll see that one of the wonderful things is that the rate of death by suicide for those who are 0 to 17 has usually trended low at 0%, except for one spike in 2020 when it rose to 4%. Otherwise, what we see is that suicide rates are highest between those of 45 to 64 years of age, and they are 32% of all deaths by suicide in 2021. The second highest rate was for those 65 and older, and that is this one right here. Oh, I'm sorry, this one right here, that's rising. And the third highest is for those 18 to 44 years old, and it's 21% of all suicide deaths in 2021. And you'll also notice that the death by suicide is 65 years and older, that is increasing, and that's important when we talk about the next, some of the next issues here. So it's important to look at the means of suicide. And the reason we decided this was important is because if you look, the large blue part of this triangle is firearms. And firearms in Montana, we have a right to bear arms, even stronger than our US Constitution gives. But it's important to note that a large number of firearms in Montana presents a significant risk of death by suicide. It is a factor in well over half of them, and it plays a role in suicide deaths more so than in the rest of the United States. In the rest of the US, firearms play only a part in about 50% of all deaths by suicide, but in Montana, it is 64%. One opportunity to decrease deaths by suicide is if we would put policies in place to restrict access to firearms by those who are showing signs they might be likely to use it to harm themselves. And one of the things that we do have at the health department at Missoula Public Health is we do have gun locks that are free. And we try and make sure that anyone who wants one has access to that, because it is a safe way to stop someone from using a gun to commit suicide. And now we're working to address suicide does require a cross-collaborative effort. There are no easy solutions, but we do have resources like the gun locks. Another promising intervention is working with primary health providers to detect risk of suicide during patient visits. And the reason I'm bringing these two things up is because they are really important for what we could do. According to Montana DPHHS, up to 45% of individuals who die by suicide visit their primary care provider within a month of their death, and they visit for a physical health problem. And 20% of those visited their primary care provider within 24 hours of their death. And for those over 65 years old, 73% were in contact with their primary care provider within a month before they died by suicide. So if we're looking at ways to intervene, I just wanted to bring these to everyone's attention because they are promising interventions and they really are relevant based on age group, especially for the older population. Now I'm just going to keep going through all of these different health indicators because that's what we're talking about. At the end, I'll provide about 10 minutes for questions. And I would just want to note, though, that these are not all of the health indicators that are in the community health assessment. It is about an inch thick document and it has 5 appendices in it. So if you want to look at all of them, there is a table of contents which shows what's in there. And I recommend especially looking at what you're interested in and don't let the breadth of the knowledge within the CHA scare you off from reading it. So now we'll talk about unintentional injury death rate by year. Unintended injuries, these are considered to be injuries, basically accidents that occur at any time without warning, and they obviously have a serious effect on people's lives. Traffic safety, mental health, poverty, recreational activities, child abuse, neglect, and infrastructure quality all affect whether or not someone may experience an unintended injury. And we don't include all of those within this because some of the indicators, such as traffic safety, they are included in other spots in the CHA. Healthy People 2030 gives us these goals, and one of the goals is that one of the notes that it makes is that injury is the leading cause of death in children and adolescents. So we should be working, then there are proposed interventions within Healthy People 2030 of what could be done to help address that. Now, if you look at our rate of unintentional injury, you'll see that Missoula is trending the lowest, which is great because we don't want to be the highest in this. We are lower than the US in 2021. We had 61.8% or 61.8% per, 61.8 per 100,000 individuals who died of unintentional injury. And that is lower than what you see in Montana at 74% and a little bit lower than what you see in the US at 64.67%. We did see a rise from 2020 until 2021 in Missoula County, and that is probably going to keep rising, but we don't know. That is also the time where a lot of individuals had different restrictions due to COVID-19 as to what they could do and where they could go. So that these trends may also change over time. An important topic for healthcare is healthcare coverage. And when we talk about that, we're talking about insurance rates, insurance access for oral health care, mental health care, as well as the rest of the physical health care. So access to healthcare in Missoula County is actually looking pretty decent in that the number of people who have insurance is pretty high when compared with the rest of Montana and the rest of the US. In 2021, our rate of people who were uninsured decreased, and we have 93.6% of the population had access to health insurance. And this has been increasing since 2017. And if we actually took this back another 5 years, you'd see more of an increase because we did see passage of the Affordable Care Act nationally and acceptance of Medicaid expansion in Montana. And all of those increased access to healthcare. Even with those nice numbers, though, Missoula County has been determined by US DPHHS to be a medically underserved area for primary care, dental care, and healthcare, and mental health care. And that's because even though we have providers, there's not enough of them, and many of them are centralized in the city of Missoula. So when you go in the outlying areas, there's not a lot of healthcare access there. So we're better than we were, but we still have a way to go. So cancer, as we said, was one of the leading causes of death. It's the second leading cause of death in Missoula County. From 2017 until 2021, Missoula had a lower cancer death rate than both Montana and the US, which is pretty great considering like I said, we are considered a medically underserved area. It's remarkable that we do have these lower rates. In 2021, our death rate per 100,000 people was 154.66, as you can see. And then for Montana, it was 203.44, and in the US, it was 187.82. So our cancer death rate is lower, and also our incident rate. So the rate of new cancers that are detected each year is also lower in Missoula. And those rates, they're not on these slides, but the rate is 417 per 100,000 people. And in Montana, that rate is 457 per 100,000 and 442 in the US per 100,000. We do see that sex is a big indicator of cancer death rates. Males being more likely to die from cancer compared to females, but some of that is because of the kind of cancers that we talk about. So as you can see on this next slide, it's the top 10 cancers by rate of cancer death. Lung and bronchus is the leading one, but prostate is high in Montana, and it's actually higher than it is throughout the rest of the US. And so that's something that bears looking into. Following that, we have female breast cancer as the third leading cause of cancer deaths. Child abuse and neglect is a factor in many health outcomes for children. Being subjected to child abuse or neglect, some people may not think of it as a health issue, but it does impact physical health, education, and mental health. And we also see that as youths age out of the foster care system, they have a harder time transitioning to adult life, which can lead to lack of insurance, lack of a place to live, lack of employment. So all of these have negative lifelong impacts. They can, and they're all social determinants of health. So this is something that we should keep an eye on and see what we can do through a public health lens to help with this. The number of children in foster care theoretically represents the amount of abuse or neglect the community has. But what we've seen with not only the number of children in foster care, but also, as this chart shows, it is the amount of investigated reports for child abuse neglect. It looks like, if you just looked at the trend lines, that things were getting better in Montana. As you can see from 2018, even though there was a spike from 2014 in both the US and Montana, this is Montana data, not Missoula. We didn't have Missoula specific data for this. But you can see that the trends go up, and then about this time, about 2018, we see that the trends start to go down, especially around 2020. And we may think that that was because there were less reports coming in. But actually what we have seen is that there were less reports being made because children had to stay home. And the people who typically are exposed to kids for many hours a day during the school year did not have access to them to determine whether or not they should make a report for child abuse and neglect. So although those trend lines look like things are getting better, they, I would say, are not getting better. And that we'll probably see that also the uptick continue once we have accurate reporting on this again. So it is something for us to keep in mind when we're looking at how we want to impact health of our community going forward. Since we're talking about children, let's talk about childcare. This is one of the social determinants of health, and something that is a large problem in Montana, in Missoula. We have numbers here on this showing this chart in front of you, showing the average cost of infant care on the bottom, care for a 4-year-old, the third down, housing is then next, and then you see college on the very top. It's counterintuitive, but it actually costs less to send somebody to in-state college than it does to care for an infant or a 4-year-old. So in 2017, Missoula County, the CHA at that point added childcare as a health indicator. And because it is a critical piece of the health and well-being of our community, we've kept it in there. Research indicates the need for consistent and excellent care for our youngest so that they have later health and well-being, from mental health to disease status to education and employment. And also the availability of childcare is necessary for the rest of the family, the adults there, to be able to work and actually support their family. The childcare is considered affordable if it's less than 7% of total income. But as you can see from those numbers, that is probably not the cost, and it is not. In 2020, we saw that the average infant care costs were $9,518 annually. And this is 52.9% of an individual's income if they're earning minimum wage. So that's well beyond the 7% that's recommended for affordable childcare. And then you see again, the cost for the 4-year-old is over $8,000, which is more than 7%, but it's also more than it costs to send a child to college, to a 4-year public college, or to buy a house. So that's something that we could focus our attention on from a public health realm. And now we're going to talk about misuse of substances, specifically drugs and alcohol. A little bit of marijuana is in there. So drug use or misuse is a public health challenge. We all know that drugs have a place in our society to treat illness, but we also see that they aren't just used as they're prescribed. The rate of overdose deaths in Montana has increased since the 2017 CHA. In 2021, it's 16.7 deaths per 100,000 people. And that's about 1.5 times what it was in 2017. We saw it spike during 2020. Again, I think we're seeing kind of a theme that with the COVID-19 pandemic, it really impacted individuals' lives in various ways. And it looks like during that time also our report of overdose deaths from drug use also increased. So we don't have deaths just as overdose deaths as a general topic. We've broken it down into 3 different factors. We have opioid, which is the blue line, heroin, which is the orange line, and then gray line is stimulants. And those stimulants include such things as cocaine or methamphetamine. So as you can see, our rate of deaths by opioids has steadily increased. Our heroin deaths are thankfully decreasing somewhat, but then our stimulant deaths are also in a trajectory to increase right along with opioids. So heroin deaths were the third leading cause of these overdose deaths. Opioids were the first, but we do have the use of Narcan that is starting to be more well known and well used in our communities. We have it available at the Public Health Department, and it is free. And we hope that possibly Narcan as an intervention may stop some of these opioid deaths. And we might see that in the next community health assessment. And then you also see that sex again is a determining factor here, with males almost twice as likely as females to die from a drug overdose. Excessive drinking. If you grew up in Montana, you knew all about this, especially in rural areas. So alcohol use. This is for adults age 18 and over. Excessive drinking is higher in Missoula than in Montana or the rest of the US. We have 23.5% of adults age 18 and over not only reporting excessive drinking, but also doing binge drinking, which is a little bit different. And that rate is also higher than what we see statewide or throughout the US. So the misuse of alcohol by adults is a factor. And also any treatment that's available is not as excessive, and there's not as much of it as we would like. One thing we do need to be especially concerned about, though, is high school alcohol use. And this is actually looks decent in that it looks like Missoula's access or the high school students who are reporting 1 drink of alcohol in the past month is actually decreasing. It's slightly lower than what we saw in 2013, which was 36.6%. And then up to 2021, we're at 35.6% of students in high school who had at least 1 drink in the past month. That is higher than Montana and the US, but this is a success in that it is, the rates are trending downward, which is good. Moving on now to a different topic is food security. And this is something that if you keep track of policies, you might see that there were some changes to policies, and some of that may have impacted how many children can access food or how many families can. Food security means to have access to nutritionally adequate and safe foods, and also the ability to acquire these in socially acceptable ways. So not stealing, but actually purchasing them or getting them through a program that gives them to you. And food security is linked to many negative health outcomes, and that's why we've included it in this. Especially for children, it can have negative outcomes because it makes their learning harder in school. But lack of food security can increase risks for chronic diseases like diabetes or obesity, heart disease, mental health conditions, and cancer, but also mental health conditions such as anxiety and depression. So these are our statistics here. You can see that it looks like Montana food insecurity rate is going down, so that's good. So 8.3% are food insecure compared to 13% in 2017. We have had services in place in Missoula. We're especially lucky to have the food bank and other food resources that help people when they cannot afford food. But then what you'll see here is on the right-hand side on that green bar graph is that the number of people accessing the food bank has steadily increased. It peaked in 2020. It peaked in 2020, but then it went down a little bit in 2021. And one of the reasons for this could be policy changes that changed who could access supplemental nutritional assistance programs in Montana. They're called SNAP. And there was a change in who could access these programs. And what we saw after this change is that less people in Missoula County were accessing SNAP, but at the same time, our usage at the food bank was going up. So people still needed food, but they were getting it in different socially acceptable ways. but the need for food for people is not something that is going away, especially with the cost of rising food. Houselessness in Missoula is another large issue that we've actually done great. Well, I wouldn't say great. We've done a good job and taken positive steps forward since the 2017 CHA to make some positive changes. One of those was the Homeless Management Information System, and it's actually managed by the Organization of Realtors, and you see it right here, 2 charts from that, showing what enrollment looks like in that for new clients and clients enrolled in the system. And you'll see it's between about 600 and 700 people enrolled, and you can see how that is trended on the right-hand side over different months, with it definitely having a little bit more people in 2021, especially during the colder months. We looked at the demographics of what it means to be houseless in Montana, in Missoula specifically. And we saw that most of people there were not, they did not report that they were veterans. But they did fall within what is called chronic, being chronically homeless. And that means that you have been homeless for a designated amount of time. And let's see, it shows that you've been homeless for a designated amount of time and that you have one or more disabling conditions that is leading to this homelessness for more than a year. So most of the people are not veterans, as the blue line shows, and they are chronically homeless. So they have a condition that is causing them to be homeless, houseless. Sometimes those are used interchangeably, but houseless is the right term to use for the duration of their time. And you see that there are more males than females. We do track transgender, non-binary, and those who refuse to give a sex designation. But by and large, the people who are reported as houseless in Missoula are males. And we also see the ethnicity. They are mainly white. As of December 2020, it was about 500 individuals who self-reported as white. And compared to that, American Indian, Alaskan Native, or Indigenous, that was about 140 individuals. We saw about 60 individuals who reported as Hispanic and 40 who were Black, African American, or African. So by and large, it is white male individuals who face some sort of recurring problem that is causing them to be chronically houseless. Related to all of these is poverty and living wage. And we really tried to bulk this up in this year's CHA because it is so relevant to whether or not you can afford a home, whether or not you can buy nutritional food, whether or not you have a job. So we included trends in this showing what the living wages as well as what poverty looks like. So the living wage is the hourly rate one needs to earn to support themselves and their family in Missoula County. The median hourly wage in Missoula increased to $29.53 in 2021. And this is from $22.19 in 2017. However, even with this increase, it is still lower than what would be required to earn a living wage for one individual. Living in poverty occurs when someone's income is lower than 3 times the cost of minimum food for a year. And that has been determined in 2021 to be $27,479. So somebody is determined to be living in poverty when their income is lower than 3 times that amount. Living in poverty impacts many health indicators and health conditions. And it's correlated with many of them like employment, housing, transportation, health insurance, access to healthy foods. So these are all very interwoven. And we also wanted to specifically pull out how many children are living in poverty. And what we see from the data here is that from 2012 through 2021, it actually has gone down for the percent of children living in poverty. But since 2019, it does appear as though that is going up. Missoula is lower than Montana in the US, but still we do have trends going up. So that's something that we should be aware of and think about how we can help those children because many times they can't help themselves. Reproductive and sexual health is something we included in the CHA because having an unintended pregnancy or having exposure to sexually transmitted diseases and infection can have many impacts on an individual's health. The CDC stated that ensuring access to contraceptive services is important for preventing not only unintended pregnancies, which account for nearly 1/2 of all US pregnancies, but also to ensure that people remain healthy. And unintended pregnancies, they're associated with adverse maternal, so for the mother, and infant health comes. And so we need to ensure that there's equitable, person-centered contraceptive access to ensure reproductive autonomy. So we looked at what our high schoolers were doing because that is possibly an opportunity. And what we saw is that high school students, we see in the US that during 2021, it trended sharply downward to the percent of high school students who had ever had sexual intercourse. And at the same time, Montana slightly trended down from 2019 to 2021, but Missoula's rose. So Missoula has increasing number of high school students who are engaging in sexual intercourse. And in 2021, it was at 41. Sorry. It's at 41.9%. And that is the highest of Montana and the US. And then we also looked at whether or not high school students were practicing safe sex with a condom, which is usually good to prevent pregnancy and diseases or infections, although not always. And we saw that while Missoula students are engaging in more intercourse, they also are stopping the use of condoms. So that is something we should be aware of and concerned about if we're talking about unintended pregnancies. In 2021, Missoula's rate was 57.9% of students who had last used a condom. That is higher than Montana or the US, but it is trending down by 10 percentage points from 2017. So that is an opportunity waiting to be taken care of. If we look at we track at the health department, especially sexually transmitted infections or diseases, and we're seeing that syphilis is rising, especially now. It used to be specifically males who were reporting, but now we're seeing more syphilis rates in females. It rose to 16.7% after being 0% in 2017 for females. And we also see that chlamydia cases by group and year, they're also, well, they're increasing for some ages, but also especially for the 18 to 24 college age students or individuals. We see that high school students, again, because they are a population that we can hopefully help to live healthier lives, their cigarette use is going down, which is great, and we should all applaud that. But what we're seeing is that their vape use has rise. Cigarette use, this is for, let's see, it's also decreased for adults. So that is great. But looking at what we're seeing for vaping in Missoula amongst our high school students, 47.9% of Missoula high school students have tried vape products in the 2021 Youth Behavior Risk Survey. And that is not quite twice, but almost twice as many high school students who had tried a cigarette, and that was at 25.7%. So the use of vaping is rising in Missoula, although it does look like it's, the current users have gone down. Youth are still trying it, and it is highly addictive, and they don't understand how bad it is for their health. So just to add on there, I said there'd be a little marijuana in here. Missoula high school students reported that they use marijuana at a rate of 24.5% of all students have tried it. And that's higher than the Montana rate of 19.7% or the US rate of 15.8%. So while the rates in Montana and the US decreased, the rate in Missoula increased. So we are seeing some trends with the use of substances amongst our high schoolers and adults in Missoula. Housing is a key indicator for health and well-being. It's a building block that you need clean, well-maintained living environment to have optimal health. And Healthy People 2030 explains that to have, if you spend a large amount of your income on housing, then you won't have money left for things like food or healthcare. And about no more than 30% of income should be spent on housing. If more than 30% is spent, then you're considered cost burdened, which is what you see in the blue in the housing cost burden for homeowners chart. And if you pay more than 50% of income on housing, that is the orange, and you're heavily cost burdened. So you can see that rent in Missoula is increasing. It sharply increased in 2020, and it's continued to rise. And also the burden for homeowners has also continued to rise, with many homeowners being cost burdened with what they have to pay. We changed our health assessment this time. Traditionally, we've had a separate section that was called Native American Health or Indigenous Health. And upon reflection, we actually decided this was not the appropriate and best way to highlight different populations. So we have pulled that section and instead included this section on Indigenous health, noting the tribal communities that traditionally call our homelands in Missoula County home. And also we highlighted All Nations Health Center. They are committed to providing health not only to Native people, but also anyone who wants to go there. But they conducted a community needs assessment similar to ours, but it was focused on culture, connections, academics, affordability, mental health, spiritual health, physical health, safety, and emotional health. That should be coming out soon, and we would refer out anyone who's interested to check their website and see when that comes out so you can see specific details. This also right here is race, ethnicity, individual systemic racism, dealing with health equity. This is a new addition to our CHA. We are all learning more about how systemic racism impacts health and well-being of individuals and communities. So we did include a section on this, which may make some people a little uncomfortable talking about race and ethnicity, but there is a great quote here that you have to talk about health and inequity in order to solve them. So health equity is a state in which everyone has a fair and just opportunity to attain their highest level of health. And that doesn't happen if we don't address racism or the systemic problems we have. And then we have taken steps in public health to try and address this, but there's a lot more that can be done throughout our communities. So now we have just a few minutes left. I'm going to go over some highlights from the survey that we gave out. Everything I just covered was that secondary data. This is now our primary data. We conducted a survey, as I said, within the county, within city limits, and outside of city limits. You see the breakdown of where the responses were from. Over 700 were from within the city, over 120 were within the county outside of city limits. Most were full-time residents, and most had lived here more than 5 years, and many owned their houses in the city as well as in rural areas. We had 856 total responses that we could use. Now, some of the highlights I wanted to talk about was, these are social determinants of health. What are the strengths in local communities that residents see? And we have in the CHA, we have the actual numbers broken out, but I wanted to provide this color chart so that you can see the comparison. In Missoula City, our major strengths are seen as green spaces like public parks, followed by healthy foods. And then we see as a major weakness, the availability of housing options, followed closely by housing security. And then this is the same question, but for Missoula County. And in the Missoula County outside of city limits, they also see their major strength as green spaces, which kind of goes to show why we live here. We love being outside. But then their next strength was public schools, which is great. And that was actually the third strength for the Missoula City residents. They also see a major weakness as the availability of housing options, followed closely by housing security and then quality of housing options. So housing is a redundant theme in many of these problems. Now looking at what we think that the residents believe are their top health issues in their communities. This is Missoula city limits. They see the major issues as mental health, substance use as drugs and alcohol, and then substance use disorder. So those are within Missoula City, what individuals believe are the major issues. And then in the county, it's kind of similar where they see mental health, substance use, drugs and alcohol, and substance use disorder as the main issues. And I said kind of similar, but it is exactly the same with just different numbers. But mental health is by and large the pervasive theme that this is our biggest problem in our communities. And going back to that, we are determined to be an area without enough healthcare providers for mental health. That makes sense. So then we did something kind of fun in our survey where we asked individuals about climate change without using that phrase. And we just talked about climate shifts because climate change can be such a divisive phrase. We really wanted just to get at the effects of it. So again, we have the full numbers in the CHA, but what Missoula city residents in the city limits have seen by and large are hotter summers, increased frequency and number intensity of wildfires, and then changing in the timing of seasonal events like frost and spring runoff. In the county, they also saw hotter summer temperatures, the increasing number and frequency of wildfires, and also changing the timing of seasonal events. So those are pretty similar, but then this is a section that we allowed them to write in extra comments, and we reported these if there was more than 2. So I think you can see just some of the people are reporting other issues. This next section talks about the shifting climate effects on those that you care about or yourself. Some of the ways that you're affected, people had increased utility costs, mental and emotional health impacts, decreased comfort, and physical impacts. This is the city limits. Similar to the county, same things. But then this is kind of interesting because now we're starting to get into, so people here are talking about what they're doing to address climate and the fears that they have. And so we continue this line of questioning and we start going through this. And what we're seeing is that there's more of a push in the outside of the city limits that climate change isn't what's causing these problems. So these are some of the ways that people, these are the things that people see: increased smoke, solar powers. But this, like the one at the bottom, higher utility bills because of the economy or rate changes, not from the climate. So that's just, it was just interesting. And then these are some of the things that get in the way of taking action to cope with our shifting climate. And it looks like policy is an issue, but one of the major ones was the cost of utilities and other actions to address climate change. Everything is just too expensive for people. And then you see again, people don't believe climate change is occurring. So it's interesting because they don't believe it's occurring, but at the same time, in the previous questions, they did note the same impacts. So that's just an interesting dichotomy there. Top concern in the city is wildfire smoke, and in the county is wildfires, probably because their houses are more likely to get burned than within the city. And that is actually the last slide I have on the survey. Our next steps, this is open on Missoula Voice until February 27th for you to provide comments. Anything is helpful. We revise this based on input, and then we will issue a final report. And then we'll begin the process for the community health improvement plan to decide what health priorities the community wants to target and then how they can gather to do that. So with that, I am open to questions, and there's my contact information if anyone wants to talk about it more. So how do we do questions?
So folks can either unmute and ask your question, or you can place the question in the chat. Any questions for Kim? First, I just want to say thank you, Kim. That was a lot of information in a little amount of time, but really, really good. So does anyone have any questions for Kim on the content or the process around the CHA?
So I just pulled up, oh, did I mute myself? No.
Nope.
I just pulled up that chat, and there are a few questions in here that I'll just answer. One question is, what time period for the childcare? That is over a year. So these are all annual rates. Yeah, so it's annual. Looks like somebody else answered that. The community health assessment is released now. Somebody wanted to know where it was. And then there is a link in the chat that was provided. You can go to it. You can read the assessment. There's also a link for a survey where we ask that you provide your input so we can gather it all together and then make any changes that we think are important to make with it from the data we have.
Hey,
Those are
Kim,
all-
thanks. Thank you so much for that really great presentation. And I love that we have a link to the data. That's great. I'm looking forward to sharing it with my classes. This is a very broad question. I just wondered if you might just reflect on some of the things that surprised you and your team as you were putting together the data.
What were some of the things that surprised us? You know, I think that we weren't surprised to see some of the trends around COVID, but I think we were surprised more looking at the poverty and living wage and cost of housing and how it's also interconnected. Because that is something that seems so immovable, but is so relevant to all of these other things. So just seeing those stark numbers, like how much it costs to send a child to a daycare for a year, then how much it costs to send a child to college, it's pretty drastic. So we were just seeing those stark numbers. I think we were a little surprised at it. But we did also have some high points, like, you know, some of our numbers are trending down, but as far as things that surprised us, that was something that was a little disappointing too.
Thanks. Yeah, it's one thing to hear parents complain about it, but to see the numbers is astonishing.
Right, right. It really is. So if you have any quick fixes for that or great ideas, we're all open for it. Any other questions?
Kimberly, I had one. Hey,
Yeah.
this is Kimber McKay speaking. It's nice to see you, and I enjoyed your presentation. You know, because we've been in training center classes together and have known each other for a while, but we hear so much from people out in other health departments around or other counties around the state that the idea of launching a needs assessment feels so monumental and difficult. What would your advice be to your colleagues in other counties for how to successfully pull one of these efforts off?
Yeah, well, it did take us a while because we are a little behind on ours, you know, thanks to the pandemic and some staffing changes, but we got it out almost on time. And so I would say that they should start small with data that's easily findable on just some indicators that they know they can pull, like from secondary data sources. They don't have to do everything. We've done this 3 or 4 times.
Mhm.
3. And so I would say start small with those indicators. And if they wanted to do a survey, we really tried to make sure that ours was done in a way that we could use it for different research, but they could also just take a survey where they can make a simple survey online using like Survey Monkey or something and just, you know, copy. They don't have to create everything, you know, from the beginning. They can just copy questions and just get input that way. It's just interesting to see. So I would just say start small on some main indicators or things that they're really concerned about.
Yeah. Would you be willing to share your survey instrument
yeah.
with other folks? Yeah.
Oh, yeah.
That's really good to know.
Absolutely. Absolutely, we would. And there are a lot of resources out there, especially through
Mhm.
like the National Association of City and County Health Organizations through NACCHO,
Mhm.
that provides you with, you know, these are the 5 or 7 things you need to do. But
Yeah.
we're happy to work with any health department to try and start tracking these metrics, because the health of our communities should be really what's driving our policies and how to really help people's health. And so I think the more we can get people focusing on this, the better it is. And looking at Healthy People 2030, I would refer anyone to that website. It is so
Yeah.
voluminous with the amount of information. And
It
I saw
sure
that
is.
even our state health assessment now has some that they've targeted that they want to track.
Oh, thank you so much, Kimberly.
You bet. Happy to do it.
All right. Any last questions for Kim? Well, on behalf of Missoula Public Health and the University of Montana School of Public and Community Health Sciences, thank you everyone for being here. Next week, Tony, I believe, is a holiday, correct? So no seminar next week, and then we'll get out a flyer for the following week. So thank you everyone for being here today, and thank you, Kim.
All right. Thank you. Thank you all for the opportunity. It was nice seeing everyone here. Thank you.
Thanks, Kim.
Thank you.